Welcome to Improving Health Equity Through Rural Economic Development, a County Health Rankings and Roadmaps webinar. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We would also like to acknowledge that this program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. My name is Joe Hinton, and I am an action learning coach at the County Health Rankings and Roadmaps program. I'm coming to you today from Chicago, Illinois. Today I'm joined by my colleague Erica Burrows-Girardi in Central Florida. Hey, Erica.
Hello, I'm not sure if you're able to see my video, but I am here, and I just want to let you all know that I'll be responding to your questions. Please put them in the Q&A box, and I'll get to as many as I can at the end of the webinar.
Thank you so much, Erica. I also want to take a moment to introduce other colleagues that are joining us to enhance their learning experience today. Attica Scott will be sending and responding to your chats today. Hey, Attica, can you give us some tips on how the audience can best get involved today?
I can. Thank you so much, Joe. I appreciate that introduction. So yes, folks, please do use the chat feature. It's the best place for me to be able to respond to your questions and for folks to be able to offer up resources. And please make sure that you're chatting to all panelists and attendees. So you'll see the welcome message I just sent, and it was to all panelists and attendees. And that's so the whole audience can read and respond to your ideas. Thanks, Joe.
Thank you so much, Attica, and she's right. We want to make sure everybody gets to read all of the great comments that you shared today. We're also pleased to be joined by our technologist, James Lloyd. Hi, James, how are you today?
Hi, Joe, I'm doing great.
Thanks for being here. James will be keeping an eye on the chat as well and helping with any technology snafus we have. James likes to keep us all on track. I also see that our colleague Colleen is on the line today. Colleen, how are you?
I'm good, Joe. How are you?
Terrific. Thanks for joining us.
Happy to be here.
I also want to briefly introduce here at the moment, at the top, our two guests today. Jennifer Little and Aaron Schulten are both joining us from Klamath County, Oregon. This community received a 2018 Robert Wood Johnson Foundation Culture of Health Award to honor their exciting collaborative work that has resulted in improvements in health and health equity. Jennifer is the director of the Klamath County Public Health Department in Klamath Falls, Oregon, and she has been a central part of the Healthy Klamath Coalition. Welcome, Jennifer.
Hi, everyone. Thanks for having me.
We're glad you're here. And Aaron Schulten previously served as the co-chair of the Healthy Klamath Coalition and as the Health Promotion Disease Prevention Program Administrator. That's a mouthful at Klamath County Public Health Department. Welcome, Aaron.
Hi, everyone. Thanks for joining us today.
We're glad you're here as well. Thanks for being here with us. By the end of our time together, we have shared outcomes for all of us to be able to apply a community development mindset to health improvement work, to examine economic development strategies and their application to your community, and to identify guidance to assist in moving your work into additional action to improve health and equity. I also want to, right here at the top, invite you to join me after the webinar to explore further all of the topics you hear about today and to engage in conversation with fellow audience members and the guests on the webinar. Immediately following this webinar, we'll offer an interactive discussion group that will allow us to deepen our learning. This conversation will give you a chance to be face-to-face with other webinar attendees, share what you're doing locally, and ask questions of other participants. We're pleased to be able to offer this session in partnership with Healthy Places by Design, and Joanne Lee from Healthy Places by Design will be our lead facilitator. Watch the chat throughout the webinar for details about how to connect to that discussion group, and Attica will make sure you're all aware of how to get there after we finish today. Before we spend some time with our guests, I'm going to start briefly with a question, why? In this case, Why does the county health rankings and roadmaps exist? County health rankings and roadmaps has two primary overarching goals. The first is to improve health outcomes for all. This includes both how long people live and how healthy they are. The second goal is to close health gaps between those with the most and least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where they live or the circumstances that we're born into. The choices we make depend on the opportunities we have. Things like access to stable and adequate employment, access to healthy foods or healthy transportation options. Not everyone has the same opportunities. These unequal opportunities create differences in health and do not come about on their own or because of the actions of individuals alone. They are often the result of policies and practices at every level that have created deep-rooted barriers to good health for some people. Neighborhoods in the same community often need different resources to be healthy. Providing them the same resources will not advance equity. Allocate resources to align with differing needs so all parts of a community are able to thrive. Equality aims to promote fairness, but it can only work if everyone starts from the same place or needs the same help. Equity addresses what is unfair, what is unjust, and what is avoidable. Communities have the power to work to achieve health equity, and today you'll learn about how the collaborative work being done in Klamath County is aiming to improve health outcomes and health equity for all. So our topic today is improving health equity through rural economic development. So that may lead us to the question that you see on the screen right now. What does economic development have to do with health and health equity? Well, economic development is a form of community development. Community development is about transforming places and removing obstacles so that people can make good choices about their health and well-being. So I'm a bit curious, and I know everyone on the webinar today is a bit curious about your path with economic and community development. What economic and community development priorities are present in your community? I'd like to invite you to use the chat box to share your responses. As Attica mentioned earlier, please make sure you use that drop-down box in the chat feature and select "To all panelists and attendees" so everyone on the webinar can see your response. We'll check back in with Attica in just a bit to see what different priorities exist with our attendees today. So I tend to think that community development is a phrase that gets used regularly, but what is it? Well, community development is a process where community members come together to take collective action and generate solutions to common problems. It's a broad term given to the practices of civic leaders, activists, involved citizens, professionals, all to improve various aspects of communities, typically aiming to build stronger and more resilient local community. While community development has been helping to put affordable housing in place for decades, now it takes a more comprehensive approach in view. It's not just about providing a stable home, but about family well-being, continuity in school, more resources for food and other necessities, and living in an environment that directly promotes health through green materials, good ventilation, active stairwells, community gardens, on-site health services. The list is exhaustive. When we finance childcare centers and schools, we're thinking about healthy early childhood development, school readiness, academic success, college readiness. Grocery stores bring economic development and jobs, but they're also about healthy eating. When community development is successful, we see good health outcomes, better academic performance, healthier eating, mental health and spiritual well-being, economic well-being, community safety, increased active lifestyles, and job training and security. When you marry community development and health, you focus your community development efforts on ones that also garner improved health outcomes. These projects help make the healthy choice the easy choice. So why is all of this important to us? This is our rankings model. Many of you have probably seen it before. But the model reminds us that health is more than just going to the doctor or choosing to avoid fried food or a sugar-sweetened beverage. In fact, health is tied to so much more. Our physical environment and social and economic factors in which we find ourselves contribute to 50% of overall health. If we are living in a community with unhealthy neighborhoods and lack of economic opportunities, it can affect our health outcomes, which includes how we live and how well we live for all of us. In today's webinar, our guests will share examples of how strengthening employment, access to healthy foods, and improved active transportation options are improving the quality of life for Klamath County residents. Before we hear from Jennifer and Aaron, I want to check in just for a moment with Attica to see what community and economic development priorities you've all been sharing.
Thanks, Joe. You've got a lot. Folks have been sharing about housing, education, and mental health, public transportation, healthy eating and active living opportunities, safe drinking water, broadband access, and ban the box initiatives, and lots more amazing ideas as it relates to community and economic development.
It's always exciting to hear a nice list of different and comprehensive ideas like that, Attica. Thanks for sharing what's going on in the chat.
You're welcome.
So before we dive into the specific policies and programs that have been adopted in Klamath County, I'd like to reintroduce Jennifer Little from Klamath County. And I hope, Jennifer, you can give us a brief overview of Klamath County.
Thanks, Joe. So for those of you who are unfamiliar with us, Klamath County is a rural community in the high desert of South Central Oregon. We're about 20 miles from the California border. And geographically, the county is larger than the state of Connecticut, but we're home to only 66,000 residents. Klamath Falls is our largest city with approximately 40,000 residents in the urban growth boundary, and it also houses our county seat. To give you a flavor of the population that makes up our beautiful community, we have 78% white, 12% Hispanic, 4% Native American, and 4% mixed race. Nearly 1 in 5 people in our community are living in poverty, and nearly half of the adult population lives with a chronic condition. In addition, 1 in 4 children are food insecure. Also, the HRSA has designated us as a health professional shortage area. So that means that we have a lack of providers for the amount of citizens that we have in our community. In addition, since 2011, when the Robert Wood Johnson Foundation County Health Rankings first came about, we paid close attention to those. And since the beginning of that, unfortunately, Klamath County has ranked at the bottom of those rankings. And it has really shown us that there are steep barriers to health across the county, including things like transportation, substance abuse, access to nutritious foods, graduation rates, and things like that. So that really acted as a call to action for our community. And so in 2012, what we call the Core 4, so our hospital system, our local Medicaid provider, which we call a coordinated care organization, our federally qualified health center, and our public health department got together, and we decided to form the Healthy Klamath Coalition. And we started by conducting a community health assessment, which a lot of you all are sure are familiar with. And then we started with a community health improvement plan, so our CHIP. And that has really acted as a springboard for the past several years for our community, and we've had huge success in many areas. And obviously we're here today because we were fortunate enough to win the Culture of Health Prize. So despite our low health rankings, we're making progress, we're seeing some success, and we wanted to share that with you today. We've got some really amazing initiatives going on.
Yeah, thank you so much for that introduction, Jennifer. And just looking at the image of Klamath Falls and Klamath County makes me want to visit. I've heard a lot of unique and interesting things about Klamath County's story, but I think it's also so interesting that we hear a lot of similar stories from other rural counties around the US. So I think that there's some great application here. We'll switch over to our other guest, Aaron, and maybe Aaron, you could get a little bit more specific with us. Could you tell us a little bit more about the Klamath Works campus?
Of course. So in 2014, several community partners came together who represented healthcare, nonprofits, faith-based organizations, government, and law enforcement. They came together to improve both social and economic well-being in our community. So one solution they came up with was the Klamath Works campus. So with the campus, an integrated model was introduced, which houses several human service offices in one location, along with the Community Health Worker Program, the Klamath Works Job Training Program, a sobering station, and our community shelters for men and women.
Well, that sounds like a pretty comprehensive model, Aaron. And I just wonder, were there barriers that your community partners had in mind when this approach was adopted?
Yes, definitely. Because our rural community is so spread out, this model helps first to alleviate transportation barriers. It helps to decrease missed appointments since clients are already there, and also saves our clients time. And finally, it improves access by ensuring community members are connected to more resources because providers are now able to do warm handoffs.
I like this idea of warm handoffs. It kind of reminds me of a one-stop shop. So I'm intrigued. Can you explain what's happening in that photo on the right? It looks quite intense.
Yes, this picture is from the Klamath Works Job Training Program. Klamath Works has a partnership with our new recycling facility to help clients who are enrolled in the program gain work experience and build their resume. And another unique feature of the program, which is probably my favorite, is that the program teaches clients soft skills. So they teach them stress management, budgeting, and preparing for their workday to help them overcome barriers which may prevent them from keeping employment once they've started a new job.
So I like this collection of local policies and programs that you've assembled here through the Klamath Works campus and through the job training programs that help people get back to work. Jennifer, as I understand it, you also have a community health worker program that Aaron mentioned. How does that program fit into your local community development efforts?
Yeah, so as we all know, in order to thrive in society, our community members first need to get in control of their health. And as we all know, health is a really complex, it's a multifaceted issue. And so, as I mentioned earlier in the introduction, we have a lot of poverty and chronic disease in Klamath. And obviously, these two things have a really strong correlation. And in addition, kind of what Aaron was talking about, because of our geographic expanse of our community, we have a lack of transportation resources, and a lot of our most vulnerable citizens were missing doctor's appointments, public health appointments, DHS appointments. And so in 2015, our local Medicaid provider, Cascade Health Alliance, teamed up with our local hospital system, Sky Lakes, and they created a community health worker program. And it started out with 25 participants and 3 community health workers, and they were basically just a non-emergent medical transportation service. So now clients had free transportation to their clinical appointments, but we quickly realized that there was potential for so much more. And so if you fast forward to today, this program not only provides transportation, but they are really getting in there and helping clients address social determinants of health by helping them find housing, securing food sources, assisting with getting documents like a birth certificate or an ID so that they can seek employment. And we also just want them to take control of their health. And so these community health workers go to doctor's appointments with them. They help them understand what those clinicians are saying. They'll take them to the pharmacy. They'll take them home and make sure they know how to use their medical equipment, know how to take their medications directly, and so on and so forth. But then in addition, kind of like Erin was talking about developing soft skills, these community health workers are also helping develop health lifestyle skills. So they'll take them to a fitness class if they're afraid to go alone, or they'll take them shopping and then go home and help them prepare a healthy meal with the tools that they have in their homes. And so all of these things help reduce community healthcare costs and allows these individuals to contribute to society either through volunteerism or employment. And really the mantra around this program is we're giving a hand up, not a hand out. And so today, there's 9 community health workers, 2 social workers, 3 registered nurses in this program, and they've seen a reduction in unnecessary emergency department visits by 35%, and they saw a reduction in readmissions by 49%, and that was during up to a year after they exited the program. And finally, the reduction in these healthcare costs has allowed our local hospital and Medicaid provider to make large investments into our community. And they were also, these community health workers were able to confirm that much of the health data in these reports, they could really bring it to life. And so they saw that a major issue in our community, is food insecurity. And so gaining access to those healthy foods is a critical component to improving health. And luckily, we have some really incredible programs in Klamath that address food insecurity.
Thank you so much, Jennifer. And there's so much in what you shared just now that I know we're going to get to revisit the questions about food insecurity in just a bit. But I think it's so exciting that when you think about what primarily began as a transportation program to really address what I'm sure a lot of rural counties have to focus their geographic expanse and maybe only one population center, it has evolved into a much more comprehensive approach that has allowed for other investments in the community. Erin, can you actually tell us a little bit more about that local food insecurity measures and some of the programs that have been developed to address that issue?
Sure. So as you can see here, the information on our food insecurity rate, this information was included in our community food assessment, which was published by our local food bank last year. So although we have seen some improvement, there is still a lot of work to be done. Another finding from the surveys conducted as a part of the food assessment was that people reported they have skipped meals or reduced their meal size because they didn't have enough money to buy more. Our food bank's Produce Connection program is working to address that. The program relies on over 200 volunteers to help distribute fresh fruits and vegetables each week during the summer months, and it's available free to any community member, regardless of income or family size.
So what are some of the results of that Produce Connection program?
Well, Joe, in 4 years, the Produce Connection program has grown tremendously. We are very proud to say that in 2018, the program reached its goal of distributing 1 million pounds of fresh produce to over 15,000 people in 1 year. This was made possible by expanding to 21 sites, which includes reaching our outlying communities and now 2 year-round distribution sites at Klamath Works and our Wellness Center. But most importantly, the food bank has seen an almost 20% decrease in food box need because families are getting the produce they need to put meals together with what's left in their cupboards until payday.
Yeah, thanks for sharing that, Erin. And I keep kind of, as I hear both you and Jennifer share this, the centrality of Klamath Works in all of your stories is so interesting. And I see some really terrific steps toward achieving food security in Klamath County. What other initiatives have helped you expand that local food system?
Okay, well, 2 other initiatives which are growing and connecting our local food system are KFARM and a new grocery store. KFARM is the Klamath Farmers online marketplace, and it's the first of its kind. It is a hybrid that combines elements of a farmer's market, a food buying club, and a community-supported agriculture model. With 18 local producers, KFARM connects our area farmers and ranchers with community members, making fresh produce and livestock products available year-round. KFARM functions through an online weekly ordering system with a centralized drop-off and pickup location. KFOM now has over 500 registered participants. It also accepts SNAP benefits, and program staff are currently working to increase participation.
Well, KFOM sounds like an awesome program, and I keep reflecting. I wish I was connected to a similar initiative. Can I ask, what other community partners, like elected officials, what role have they had in your food security interventions?
So one neat initiative was when a grocery store in our community shut down in 2015, it created a food desert in an area which has many elderly community members and people with limited transportation options. So in less than a 2-year time frame, our county commissioners took it upon themselves to purchase the building and recruit a grocer that then renovated the building. This resulted in a new grocery store opening in our downtown area last fall. It created new jobs and ended the food desert in that area. Additionally, the grocer now also purchases products from our local producers to make available in the store.
This is a really interesting example to me of elected officials as a community partner taking a very active role in community development and health improvement. Jennifer, I also understand there are other investments in the built environment that have spurred economic development and increased opportunities for better health.
Yeah, there absolutely have been. And as I'm sure all of the audience members know, we know that our zip code has a huge impact on our health. And Klamath has been working to improve the built environment in equitable ways to improve both health and economic well-being. So a few years ago, back in 2014, we had 2 local health professionals from our local hospital and the wellness center, and they had a vision to build a protected bike lane as a way to promote safe and active commuting. And so to determine where it should be built, they teamed up with a local professor and some students at Oregon Tech, and they used GIS, which is Geographic Information Systems, or mapping, and they analyzed and mapped health data from over 60,000 hospital records. And they found that 2 areas in the community stood out on these maps. One was a neighborhood with an older population and a high prevalence of chronic illness. And then another one that had a younger demographic with a higher occurrence of obesity, yet they didn't have the subsequent chronic conditions yet. And so it was determined that that second neighborhood that was a little bit younger and wasn't quite experiencing those chronic conditions, they would be a prime location for an intervention, such as a protected bike lane. And so it just shows that, one, these maps and using data was really instrumental in helping this plan get approved by our city council. And then remember how a few minutes ago I said that the community health worker program allowed for the CCO and the hospital to make investments in our community? Well, upon approval of the protected bike lane plan, our coordinated care organization, the CCO, they made a huge financial contribution to this project and actually funded this protected bike lane to be constructed. And in addition, we've also seen an incredible investment of time, money, entrepreneurship for the built environment in one of our highest needs neighborhoods here in town. We read in a state report that they deemed the Mills neighborhood as one of the top 5 poverty hotspots in the state. And so in 2018, our partners in local government rallied, and they used a health equity lens to really change that neighborhood. Blight was an issue that caused both real and perceived crime. City council began issuing mini grants to residents to make small improvements to their homes, whether it's painting a fence or painting some of their house, fix the broken windows, things like that. The city police provided increased presence in that neighborhood, and they helped with a very large-scale neighborhood cleanup. The Parks Department teamed up with the local Medicaid provider, our CCO, and they pumped over $40,000 and many hours of volunteer time into that central neighborhood park, and they completely renovated it. And so now that park is highly utilized. Several small businesses have decided to set up shop in that neighborhood because they saw some of that growing potential. And then in addition, aside from that neighborhood and aside from that protected bike lane, which are all fabulous, Our local hospital has made big investments into several other parks around the community. All of those improve physical activity opportunities. It increases property values. It encourages economic development and tourism, and it makes people feel safe. So all of these things have to do with health. And in addition, in the past 4 years, we've seen 2 new parks built, 2 parks renovated into these beautiful spaces for recreation. And lastly, our community has luckily gotten some grants. We've done a lot of planning work, and so we've developed an urban trails master plan and a safe routes to schools master plan. And those things guide our ongoing built environment investments that encourage safe, active transportation and recreation while boosting property values. And we've seen that having these plans in place makes us very ready for applying for grants, and a lot of grantors require those kind of plans to even apply. So we're in a really great spot.
Yeah, and I just can't help but kind of think about all of the different partners you mentioned that are involved in each sequence of this step. But I think about when we're thinking about the protected bike lane and the park development, you have representatives of academia, you have representatives of the local city and county government, you have public health obviously involved, you have the hospital system, and that it all results in an amazing active transportation plan. Jennifer, can you tell us a little bit more about the path to improved health equity in Klamath County and the path to improved economic development?
Yeah, and so one thing I would say is being in a rural community, although it does have its pitfalls and some lack of resources, but the strength that we really have is because we're a small community, we know each other, we're friends and neighbors, and so making things happen and having some of those multi-sector partnerships has been a little bit easier. And so I mentioned at the very beginning, we formed the Healthy Klamath Coalition, and that has really been the foundation of all of this health improvement work. And I really encourage the audience members to go and check out the website. It's www.healthyklamath.org, and you can learn about more of the great work that's happening in our community. And this website serves as a central hub of information for community members, for our community partners. It's got those GIS maps on there, it's got local reports, community health assessments and improvement plans, links to other initiatives there. And like I said, we only talked about a few initiatives that are going on here, but there are so many other cool things happening in our community. And so also on our website, you can read our Culture of Health Prize application essays and watch our video, and it highlights some of those other things going on.
Thanks, Jennifer. And I'm sure everyone will want to check out the Healthy Klamath website, and I encourage you to do so. We'll make sure we include the link to the website in the resource guide that's emailed to all of you in the days following the webinar. So if you didn't get a chance to capture that address, don't worry, it'll end up with you in the next couple of days. So I want to personally thank Aaron and Jennifer for sharing how the economic development strategies in Klamath County have resulted in both better health outcomes and increased economic development. We know, however, that the strategies that work in one community might not be the best for your community. On the screen right now are just a few solutions that come from our What Works for Health menu of evidence-rated strategies for community development. So as you kind of scroll from top to bottom on the screen right now, you see community development block grants, which are often known as CDBGs. Those provide funding for local community development activities such as affordable housing, anti-poverty programs, and infrastructure development. You see a piece for transitional jobs. The transitional jobs structure, you can also find the strategy for that in our What Works for Health guide. And zoning regulations for land use policies. Those address aesthetics, safety of the physical environment, street continuity and connectivity, residential density, proximity to businesses, and so on. All I'm offering here is that the links to the What Works for Health resource from our website will be included in your resource guide, and it'll allow you to investigate strategies that will work best for your community. So, before we move on to our next section, I'm assuming that some of you have probably explored our What Works for Health resource before. We're going to launch a poll here in just a few seconds to check in on what other resources from the County Health Rankings and Roadmaps website you've used before. Once the poll has been launched, you can select as many options as you like, and I'm going to ask Erica to report out on what your responses are.
Sure thing. All right, so James, our technologist, has launched that poll, and so you should be able to see it right now. We just are curious about what other county health rankings and roadmaps resources that you may have checked out on our website. You may have to scroll down, but your options include the county snapshot, our state reports, meeting with action learning coaches like Joe, Attica, or me, visiting the Action Center, visiting our partner center, taking a look or completing our action learning guides, attending a webinar or watching a webinar recording, and the resource guides that we send out, reading the RWJF Culture of Health Prize stories, reading communities and action stories that we have on our website, or maybe something else. If you scroll down, you'll see there's an option for something else. Joe, I think this is pointing to the fact that there's a lot of stuff on our website.
There is a lot of stuff on our website. I'm kind of interested in the something else. I hope people will chat in what their something else is as well, so that we know what everyone's looking at.
Yeah, so we're going to ask you to go ahead and complete that. Looks like things are slowing down, so I'm going to ask James to close the poll in about 5 seconds. I think he did. He closed it. So go ahead. Thank you, James. But he's sharing those results with you now, and it looks like most of you have seen your county snapshot. At least 90% of you have, so that's great. And Joe, you probably see the results as well. So we see some folks have visited our Action Center. They've met with a coach. Some of you have actually looked at our Action Learning Guide. So Joe, I know you want to share a little bit more about that because it's about 12%, but you know, I think this is a resource that you probably want to share more about because I think it'll be helpful for folks.
Erica knows me oh so well.
I do.
So like Erica said, we wanted to lift up those action learning guides. And I'm excited to see that several of you have had a chance to look through those and utilize those action learning guides. But for those of you who haven't yet, we just want to lift up these guides as another resource to get you started in taking action. If you've tried one, we'd love to hear which guide you've selected before and which one you've proceeded through. We presently have 3 guides on our website: Introduction to Equity, Partnering with Residents, and Getting Started with Policy Change. So if you've sampled one, let us know in the chat. For the rest of you, I'll give you a brief overview of what this resource is all about. These guides help you prepare to take basic steps to transform your community. They've been designed with an eye to specifically support you and your partners as you get started on each of those topics. I particularly like these guides because they're self-paced. They fit into your busy schedule. You can revisit them and see them for 10 minutes one day and 20 minutes the next. And they're interactive. They have guidance, they have tools, they have activities. They give you a chance for both hands-on practice and reflection. You can find those action learning guides on our website under our Take Action to Improve Health section, if you just use the orange navigation bar of our website. And of course, that handy dandy resource guide that I've mentioned several times will include a link to those guides in that. We hope that you'll consider sharing this resource with others in your organization or community who might want to increase their knowledge on these topics. I really like them as a tool that allows us to bring other people in our coalitions along on the journey with us. The second resource that I really want to lift up, because there's a dashing group of human beings on the right side of your screen right now, is our action learning coaches. Maybe some of you on the call today or on the webinar today are thinking, I'm just not ready to take action. I need to do some deeper thinking about my community. Well, I'd like you to consider reaching out to an action learning coach like me. Our team of coaches are here to point you in the direction of getting started. If you need a thought partner to help you get unstuck or to think about how to use any of the resources that we've talked about today, reach out to us via the Contact Us form. You'll find the Contact Us button at the bottom of our launch page on our website, and honestly, you can find it in a lot of different places throughout our website. As soon as we hear from you, one of our coaches will be in touch with you to learn more about your community and help think about your specific needs. So as we reflect on our time spent together today so far, and before we move on to question and answer time, I wanted to highlight a few key takeaways from today's webinar. And I continue to reflect and learn from our guests from Klamath County. The key takeaways I had in mind were that economic and community development priorities can be selected to intentionally improve health. We can really use those priorities to also result in better health in our community. The benefits and reductions in costs from one policy or program can create space for other investments in the community. We heard about the reduction in costs, the reduction in admissions to the hospital in Klamath, and that allowed the hospital to be an investor in other aspects of the community. And I think that's an exciting takeaway. And the last one, multi-sector partnerships are vital to economic and community development and improving health outcomes. And I'm sure that's not a surprise to most of us on here, but as I got to learn more about Klamath County for this webinar, that's the thread I saw throughout. It's just that there was an active and ever increasing number of community partners who are engaged in this work. So we're going to want to hear from you after today's webinar. So before we get to our question and answer time, one last commercial that we're going to be able to take some time to answer your questions. Make sure your Q&As have made it into the Q&A box. I guess just your Q's into the Q&A box. But I want to invite you to do a favor for us before we get to those questions. We'd like you to share your thoughts on today's webinar. So I'm going to ask Attica to share a link to a brief evaluation in the chat. My tip for all of you is if you could just click on that link when you see it in the chat, it's going to open up that evaluation in a different window. Just save it for later. We want you to have the link. We want to get your feedback. And we're going to use that feedback closely and incorporate it into future webinars. So click it, save it, revisit it, and we will make sure we adapt our work in the future. So without further ado, I'm going to stop my screen share here and let us come back onto camera. We have a time to start thinking about some of the questions you've been asking in the Q&A box, and I know that Erica's got some queued up for us all to think about.
Yeah, well, first of all, let me just thank everyone who has been asking, I mean, literally really good questions. It's been a very active Q&A box. But we did have some folks that even when you registered, asked some questions then. So I want to, start by asking a couple of those questions that came in early on when folks registered for the webinar. Erin, I think this one might be a good one for you. How can we make a case for business owners to engage in community development?
Yeah, that's a good question, Erica. Sometimes the businesses want to know what's in it for them. So here's a few things you could tell them. These investments in the community, they help to establish a healthier pool of employees who can now focus on their job instead of where their next meal is coming from. These improvements also help to improve the health of our community members, which will help decrease the overall health care cost. That in turn is what's reflected in the health insurance costs for employers. So that's where they will care. Right. And then finally, there's the potential to increase the number of customers. So for us, the built environment improvements, such as the protected bike lane, they appeal to tourists who will then become customers.
Yeah, I love the approach that you took, which is what's in it for them, because that's the way we should think about how we approach any partner, and the business community is no different than any other partner. So thanks for sharing that. And Jennifer, a lot of folks who join our webinar today actually live in rural communities or may support folks doing rural community work. And one question that came up a lot when folks was registering is, how do you get started with economic development in a rural community? Because the opportunities are different.
Yeah, absolutely. And really, like I mentioned before, because we are a smaller rural community, you know the business owner, you know the elected officials, you're all going to the grocery store at the same time. And so having those conversations with each other and saying, hey, I've heard about this great idea. What do you think about it? And then really it's setting up a meeting, getting to know them and building those relationships, because then you can find that common ground and you can understand that we're making lasting changes, not just, one intervention is going to be gone next year. We want these sustainable interventions to be available. And then certainly, just keeping people involved at all levels, because people want to feel engaged and they want to feel like their voice matters. And so giving them that platform to do so is really important.
Yeah, I think one of the important things I heard from you is building relationships, and building relationships and whenever you want to start any type of, or co-create any type of product, any initiative is actually core to making that initiative successful. You got to build those relationships first. Now, one of the assets about being in a rural community is that a lot of times you do know folks. So you're right. You can start that informal conversation somewhere and then look at formalizing a partnership from there. So that's great. But you also talked about keeping people engaged. And so, Erin, I want to ask you that, because there were some questions that came in on when folks registered, but there were also some questions today in the Q&A box about how do you keep these partners engaged once they come to the table?
Yeah, that's a great question. And we kind of have a lot of lessons learned that we've learned over time. So my first tip is to make it relevant and align priorities. So for those of us doing the immediate health improvement work, it's a natural connection to housing or transportation, but they may not see that. So we need to show them that and show how it aligns with their programs, policies, and their priorities, and how they can work with us. And then when you're doing meetings, because there's lots of meetings, with your meetings and initiatives, make sure that they're productive. So when people come, they want to have a purpose and they want to be involved. So if they're coming to a few meetings and they can't contribute, or they aren't getting anything out of it, that's when they're going to stop showing up. So give them a purpose and a reason to keep coming back. And then something we've really learned throughout the prize process is celebrating our successes. Whether it's a small win or a big win, people put so much time and energy into starting the initiative, and once we get it up and running, then we move on to the next thing. So we need to be sure to share the results back out, not just with our partners, but with the community members, so they can see what's happened. So, oh, we are making progress. Things are actually happening. This is great. Now I want to get involved in the next thing. We're seeing how this collaboration is being fruitful now.
Yeah, that feedback loop is so important. So one of the things I will share with you ladies, you guys are so, you're busy on the webinar. You did not realize that a lot of questions came in about community healthcare workers. So people want to know about how the program is funded, whether or not they are paid a livable wage. So who can shed some light on how the community health workers fit into this equation?
Yeah, I certainly can. I, in fact, was the supervisor of that program before coming back here to public health. So it's funded through our local Medicaid provider. So Cascade Health Alliance, they have a contract with the hospital to fund that benefit. And also the question was asked about their wages, and actually they do pay an excellent wage, especially for this rural community. And so they're making well above minimum wage. And we actually pay for these individuals to go become certified community health workers. They don't have to already be certified. And we're trying to figure out a way to bring that community health worker certification to our local community college, so that more people would have access to get the training on their own, and it kind of gives them that leg up. But as of now, that's how the program is run.
That's great. I love the fact that you are building the capacity of your community health workers, that they don't have to come certified. You know, certification is not cheap and some people can't afford it. So they may not come to you certified, but you are actually helping them be able to earn that certification. I think that's wonderful. So thank you for sharing that. I think we have time for one more question, Joe, and then I'm going to toss it back to you. But earlier you all said that a percentage of your population are from Native communities, and we did have a couple of questions about that. So folks want to know how they've been involved in the initiative or how the initiative has actually been inclusive of them. So let's hear that, and then we'll toss it back to Joe.
Sure, I can take that one too. So the Klamath tribes have actually been really involved in a lot of our initiatives, and that wasn't the case in years past. But we've made, again, some really good relationships. And so we've got, for example, a produce connection and a park and play site out in Chiloquin, which is their sovereign land out there. And they've been heavily involved in our tobacco cessation work. They have been involved in a lot of the community health improvement work. So for example, they've been a part of the Healthy Klamath Coalition, a part of the prioritization process, all of those kinds of things. So yeah, we do work closely with our Klamath tribes.
Good. I'm sorry I did not get a chance to answer or ask rather more questions, but I do want to encourage you to come to the discussion group where we can actually dig into more of those questions. So Joe, I'm gonna toss it back to you.
Yeah, thanks, Erica. And I'm going to take back over your screens and make our faces disappear here in just a moment. But Erica is right. One of our great results of today's discussion group is that we want to take some of those unanswered questions that all of you had and transition them over to the discussion group. So if there's something that you were really excited to talk about that you didn't get a chance to mention with the rest of, or have addressed in the larger group, we'd like to hear all of your thoughts and hear the thoughts of our guests on those topics. So we hope you'll join us for that in just a little while. One of the items that you've probably heard that has been weaved throughout our conversation today is that our guests from Klamath County were part of the prize application process, and that they were sharing several of the pieces of their prize application for the Robert Wood Johnson Culture of Health Prize on their website. So we're excited to be able to say right here today that the call for applications for the 2020 Robert Wood Johnson Culture of Health Prize is now open. So as you can see on your screen right there, the Culture of Health Prize honors and elevates U.S. communities working at the forefront of advancing health, opportunity, and equity for all. And so we want to hear about your story and about your path. If you'd like to get more information about how to apply for the Robert Wood Johnson Culture of Health Prize, you can visit the link that's on your website on the screen right now. And we'll make sure that's included in your resource packet as well. One really important save the date for all of you is if your community is interested in applying or even considering applying for the Culture of Health Prize, on September 24th from 3 to 4 o'clock Eastern Time, there will be an informational webinar about how to apply. So make sure you set aside some time for that. I also want to encourage everybody on the webinar today to stay in touch with us. We have a presence on Facebook and Twitter. You can learn more about upcoming webinars, our latest tools and resources by signing up for our e-newsletter. So make sure you check us out on Facebook, on Twitter, or by subscribing to our newsletter. In just a moment, Attica is going to share the link in the chat for you to join us in our discussion group. While she's doing that, I'm also going to remind Erica to capture some of those outstanding questions from the Q&A box so that they can end up in the discussion group as well. So I know that Jennifer, Aaron, Erica, and our partner Joanne Lee from Healthy Places by Design, we're all looking forward to hearing and participate in some of the discussion around those questions. So I want to give a huge thank you to our guests, Jennifer and Aaron, to my awesome colleagues for their support. And I want to thank you for taking time out of your day to spend some time with us. Please make sure to sign up and join for that Culture of Health Prize webinar in September and for our next webinar in October. Have a great day, everybody.